dinged. It's 1 o'clock. Thank you guys all so very much for joining us. We're so thankful that we're able to get together on today and have this platform and this technology that makes us feel like we're really together and we are together and we're in this together. And so I want to tell you about Kevin Gallagher. He is going to be our speaker today, talking about BOTOX and his experience. And I want to remind you that we are not medical professionals. We're not giving you advice in regards to the medical profession advice. We're giving you advice based on experience and the things that each of us have encountered in some way or format on each of our SPF talks. So Kevin is a retired paramedic. He has been an emergency and management service educator who was diagnosed with PLS in 2018. He is absolutely an avid consumer of medical research, constantly reading, looking for information concerning his health. He is a passionate advocate for patients to be well informed and active participants in your own healthcare and healthcare decisions. He is a member of the SPF Education Committee. Thank you so much, Kevin, for being a part of that committee. And also he works with and serves with the Arizona ALS Association's Care Services Committee. So Kevin, I'd like to thank you so much for joining us today, and please take off and go right ahead.
Well, thank you, Norma. It's a pleasure to be here and a privilege to be able to share information about my journey and hear other people's experiences and thoughts and ideas. Like most of us, it was not a quick trip to my diagnosis. And along the way, my neurologist wanted me to do genetic testing for HSP. And at that time, I was unfamiliar. In the course of researching that, I found the SPF and was extremely impressed about the resources and information they offer people with HSP and PLS and the research that they do. So it's a genuine privilege to be involved with the organization and to be able to be here today. So I appreciate that very much. And I'm going to talk a little bit about my experiences on the road to receiving BOTOX injections. And I think most of us share another thing in common, which is some degree of spasticity. And I would like to review some of the things that I went through on my way to the decision to receive BOTOX, as far as trying to find ways to mitigate some of my spasticity. And for me in particular, that manifests in my legs, feet, my hands, arms, and as you can probably tell, my speech as well as my ability to swallow, and also my temporomandibular joints are getting spastic. So I have a good compendium of different issues to address. So once I was diagnosed, and spasticity was my major problem at that time, my neurologist, who is a neuromuscular disease specialist and runs one of the 3 certified ALS clinics in Arizona, I was very fortunate to find him. So he's very experienced dealing with not only PLS, but he has patients with HSP, MS, pretty much the whole gamut of neuromuscular disorders. So we tried oral baclofen initially for me. And as you may know, baclofen is a drug that is used for spasticity that acts in the central nervous system to inhibit the release of neurotransmitters that allow the muscle to contract. And like most of the oral medications, it has other side effects. And one thing I found that is true with every type of treatment modality and every decision that we have to make with our healthcare is at the end of the day, it's a cost benefit analysis. So everything that has a beneficial effect is going to have side effects as well. And we have to weigh whether the benefit we receive is worth the side effects. So the oral medications like tizanidine, which I tried and didn't work well for me, it does for a lot of people. Baclofen and the benzodiazepines like Valium all have other side effects. So when I was taking the baclofen, I developed a tolerance relatively quickly and had to keep increasing the dose. The side effects became such that I didn't care to continue and I backed off on the dosage. And most all of these medications, you have to go on in stages and go off in stages because there can be some pretty severe withdrawal symptoms if you quit too abruptly. So I backed off on the baclofen, and my neurologist suggested that I consider an intrathecal baclofen pump. And I did quite a bit of research on that and visited a physician that implants them twice to discuss the possibilities. Well, those are very effective for a lot of people and have some advantages, certainly over the oral medication of baclofen, because when you take the oral baclofen, very little of it crosses the blood-brain barrier into the central nervous system, which is where it takes action. Whereas with the intrathecal baclofen pump, you're putting baclofen directly into the cerebral spinal fluid. So the dosage is a factor of 100 times, give or take, less than what you may take orally. So a lot of the undesirable systemic effects that you get with the oral medications are not a factor. For me, I decided not to do the baclofen pump for a variety of reasons. There is nobody where I live in Flagstaff, Arizona, that can maintain, fill, or implant the pumps. So it would necessitate a trip to the Phoenix area for me about every 3 months to get refilled and also to get the pump calibrated. And the fine tuning is a big factor in the success of the intrathecal pumps. And they're affected by pressure, temperature, and other things. And I live at 7,000 feet, and I would be going down to about 1,000 to get the pump adjusted and filled. And that and other factors, the pump's battery life is 4 to 7 years. There's been a number of issues with recalls. I just decided not to do it. Your situation may vary if you're considering that. So I worked out a different drug regimen with my neurologist, and I combine a lower dose of baclofen during the day with diazepam, Valium that I only take at night to control spasticity and cramping when I sleep. And that's been pretty successful. And he proposed BOTOX injections, which he does quite frequently for a variety of his patients. So I researched BOTOX, and just to give you a little background of what I found that I was interested in when I looked into it, is that BOTOX is a very potent neurotoxin, and it's derived from the botulism toxin, and there are seven types of BOTOX that have been identified as long ago as the late 1800s. And they labeled those A through G. Right now, the type of BOTOX and the trade name BOTOX itself is a BOTOX type A. Recently, a type B called MyoBlock has been approved, but the majority of BOTOX used is type A. And initially in the late 80s, it was used for spasticity, primarily for several diseases that had to do with spasming of the eyes and the muscles surrounding the eyes. In 2010, it was approved for upper limb spasticity, and it has evolved to be used for other things. Migraines, it was approved for about the same time, about 2010, and also for other things, including bladder spasticity. And so it's become more common in the last decade or so to be used for a variety of things. And when BOTOX is used, the technical name for the process is chemodeinnervation, which basically means the botulinum toxin acts on the interface between the motor neuron and the muscle to block the release of acetylcholine. And it does that, and then basically that muscle cannot get the stimulus required to allow it to contract. So when you get BOTOX injections, you're getting them typically intramuscularly, and they may be directed either by palpation. So the doctor may look at your gait if it's going into your legs. They may have you stand and engage those muscles, palpate them, and then decide on where to do the injections. And BOTOX has guidelines for how much total BOTOX may be used, and also how much of a guideline is for each muscle. So how much would be used in the medial head of the gastrocs, for instance. It might be 3 different locations of injections and a total of 75 units. BOTOX A anyway is dosed by unit. I've been receiving between 300 and 400 units over the last year every 3 months. And the reason for that is there's as much art as science to BOTOX, because there's so much individual variation between patients that it's a little bit of experimentation, not necessarily for the location, although that's part of it, but also for the dosage, because since it de-innervates the muscle, you're trying to find the sweet spot of balance between a beneficial reduction in spasticity, but not inducing too much weakness. Because, for instance, my first round of injections, I experienced a couple falls just because my legs were excessively weak after the injections. I have not had that problem since because my doctor adjusted the dosage. When you receive Botox injections for spasticity, typically you start seeing effects between 2 to 7 days, and you reach the peak of those effects somewhere between 3 and 5 weeks typically. After about 3 to 4 months, the nerve synapses to the muscle start to regrow new sites where the acetylcholine can be released, and the effect of the Botox injection starts to reverse around that time. And typically they will not do new injections shorter than 3 months from the initial injection. And there's several reasons for that. There's some concern about being cautious of allergic reactions. It's also possible to build antibodies and reduce the effectiveness of the Botox injections. There's been a number of research studies specifically on patients with HSP and some with PLS, and the results have varied. At least one study showed a reduction in spasticity, but not necessarily any improvement in gait. There has been several others that showed both. So improved spasticity and also improved gait, both speed and ability to walk a given distance were improved, and also some non-muscular effects like a reduction in fatigue. Because as most of us know, the spasticity that we deal with daily brings an increase in fatigue. So they found in some studies that that was benefited as well. And the problem with any study with HSP and certainly PLS is the scarcity of patients. So these studies range from a patient population of 18 to 44. So not really large studies. They were by and large pretty well constructed, and I think have meaningful results. But I just wanted you to know there has been an effort to look at this specifically for patients with HSP. So I plan on continuing with my mixed regimen of Botox in my lower extremities, which has helped me not necessarily so much during my normal gait, although it has benefited that. But I used to have a particularly difficult time going down slopes and downstairs where my spasticity would prevent being able to move my legs well enough and bend well enough to slow myself down and control a descending gait. the Botox has helped substantially with that. And so I plan on continuing to do that, as well as to do a reduced dosage of oral baclofen and at night the
Hi,
diazepam. So that's
doing
about how far I
for
wanted to
my
go
neurological disease.
before
I'm
we
on the
open
internet
things
with a
for
lecture.
questions.
So,
So I will turn things over to
no,
Norma now. Thank you very much.
okay. Thanks anyway, Scott. Bye-bye.
Thank you so much, Kevin. That was very informative. And I really appreciate the journey that you have been on and the things that you have learned and encountered. And it's a continuous thing, right? I mean, you said it's constantly changing, and you've got to constantly be monitoring and be an advocate of your own circumstance. So thank you so much for opening up and sharing that with us and helping us to understand what you've been through. So what I'd like to do is open up the conversation. I already see Kim with her hand up. And remember, you guys, please go down into the reaction. So hang on, Kim, I'm going to call on you and let you start asking or talking right quickly. But go down into the reactions and add you guys in as raising your hand, because that actually puts you in a format that lets me see who maybe is next to ask. So Kim, you go ahead, and then Jackie, you're going to be on the standby. Go ahead, Kim. Can you unmute?
Can you hear me? Can you hear me now?
Yes, ma'am. Go ahead. Go.
Okay. On the Botox, is there any, I've been looking for copay assistance and for like 3 years and I can't find it. And I'm under Medicare supplement. So it's harder. I can't get it through the maker of Botox, so Allergan. So, and I've looked through, I think HealthNet dot something, and HSP isn't there as a, disease or anything, and they don't have spasticity on there. So I can't find a copay assistance, and sometimes the Botox, gets so high and expensive depending on how many units you get. I just got it a couple of weeks ago. I think it was, a couple of weeks ago. I got 400 units, and it was, I didn't use the EMG machine, so it was almost $500. But the 3 months before that, I did 500, and it was like 600 and something. And so I pay that, myself. My insurance pays 80%, and I pay 20. But I would like to see if I can find a copay assistance. So does anybody know of a copay assistance with if you have Medicare?
Norma, may I answer?
Yes, sir. Go ahead, please.
Kim, my experience has been that I have Medicare and I have a Part G supplement, and it pays 100% of my injections.
Really?
So I don't have I'm having a mental lapse. The type of Medicare supplement that is more broad-based but has copays. I have an actual Part G. So once I hit my copay for Part B, then I don't pay anything. I do initially till I hit the copay on my Part B. But it is expensive, and my doctor does it by palpation. But as you pointed out, some people use ultrasound or EMG, which is probably going to increase the cost. But I've had good success. My supplement is just United Healthcare through AARP. And like I said, I have a Plan G supplement, and mine at least is covered, but insurance is so variable. And what I was trying to think of was Medicare Advantage. I do not have that, and I would expect there to be more of a copay for people that have an Advantage plan.
Yeah, but it doesn't happen.
And I don't know if anybody else has suggestions for Kim.
I think I have the same thing that you have. Mine's 100% paid for. And I do the EMG guided needle.
Yeah. So do you use the Part B, and they pay 80/20, and then you hit the highest point on the the prescription, for the Botox, and then you go to the G like he was saying, the Part G?
Well, the G you have to pay for every month. It's
Okay.
it's a supplement. So
So,
any healthcare you have that picks up the extra 20%.
right,
Anything you have.
yeah. So how do you
Right.
get the Part G? I mean, is that something I could still get with my insurance, or do I have to wait till the next year? Because I've never heard of the Part G.
You probably have to wait until the enrollment period.
Okay. Nobody's ever talked about the Part G ever. So I'll
Yeah.
have to look into that.
Medicare supplements, Kim, they have them lumped up by letter, and the different letters are different degrees of supplement that the federal government dictates. So Plan G is just one of those. And the other thing that occurred to me is your doctor needs to know how to code this. So when my doctor codes mine, he uses HSP in the coding process, because for Medicare, PLS is so rare that they just don't have that on their list of codes that they can use for spasticity. But whether or not your insurance covers you really comes down to how the doctor codes the procedure. And so I would talk to your doctor about how they are doing that coding. Like I said, my neurologist does a great deal of these, and he has a person in his office whose sole job is coordinating Botox. So she is very knowledgeable about how to code it to get the insurance to accept it.
So what is that? What is that? And I think they use the code for HSP, but what is that code for HSP? Do you know?
I
number?
do not know without
I can't remember.
talking to my Botox coordinator. I am sorry. That's information that can be acquired, though. I don't know if there's a way that Norma can try to pass on that information if anybody on the call can get it. I can certainly call my doctor's coordinator and ask how they code that specifically. I just
Okay.
see a little bit of it in the notes after my visit, but it doesn't have the specific codes.
That is something that I'm making note of, and that we need to see if we can, obtain that and then be able to share that so that people understand and what they can then help explain to their doctors. I know we've got over in the chat box, Diane, that says that she would like to speak, that she has lots of Botox experience. So hold on a minute, Diane. But Jackie, your hand is raised. Did you get a chance to mention your question or any other comments you had there?
No, you know what? I'll unraise it right now because that's what I wanted to say was about the insurance and
Great. Well, then let me go ahead and call on Diane. And Diane,
Okay.
anybody else that wants to get in line and have conversations? Did you want to say something else, Jackie?
I just want to thank you, Jackie and Kevin, for your information.
Thank you,
Thank you.
Kim.
let me just say one thing, Kim. It's not cheap to get a supplement. It might be $200 a month, but
Mhm.
I require so much health care. It's worth it. Complete, because
So
you never
who-
pay. You
who
never
is
pay
your-
a penny.
You never pay for them?
No, I think it's G too, but
So what healthcare company do you use? Is it a supplement?
you know what? It's Blue Cross Blue Shield.
Oh, okay. See, I was gonna
Okay, let me
cheat.
go ahead and let Diane come on, please. Diane, if you'd like, you've got a question or you've got some experience.
I
Go
have
right
lots
ahead.
of experience. Okay, I
Thank you, Diane.
have PLS. I get 600 units in my legs. I've been getting injections in the legs for at least 5 years. I also get injections in the throat. I've been doing those for at least 12 years. I have Medicare. A word of caution on Medicare, they will authorize up to 600 units without question. When we tried to go to 700 units, even with the doctor having medical verification, they would not authorize it. I got stuck because we had injected 700. I ended up having to pay for that 100 units out of pocket, which is $1,200. So it's
Jeez.
very costly. You do want it under insurance. Medicare, the wording on it says they'll do it 4 times a year. But we get pushback, say I do it on like March 16th, if it's not June 17th or later. So it ends up being every 14th week because the Medicare processor has issues if it's, say, 13 weeks, but it would come back on, say, June 15th. Okay, so that's an issue with that. Also, if you have Medicare and you're getting Botox in 2 locations like I do, I get it in the legs, I get it in the throat. Do not get them on the same day. Okay, you absolutely cannot do that. For Medicare processing, in terms of, okay, I know my voice sounds not great. This is because the diaphragm is weakening. Okay, but a lot of people don't really pursue Botox in the throat with PLS. But if you have any gag, if you have any swallowing issues, or if you have some speech issues, it's absolutely worthwhile. With the throat, the frequency has varied. Okay, the quantity is super small. Okay, in my case, it's like a quarter of a unit, okay, or 3/10 of a unit. And it has varied from every 5 weeks to every 12 weeks, depending on where I was in the process. And also the other thing with the Botox in the throat, in my experience, okay, is that the gentleman who gave the introduction, which was excellent and very comprehensive, you know, he was saying he was having issues with baclofen. Okay, I don't have issues with baclofen. I take 200 units, which is 2.5 times the maximum dose. And so as my baclofen increased, the amount of Botox I took in the throat needed to vary. There was a period where I took off a couple of years because the baclofen, as it increased, was sufficient. But the baclofen in the throat is really, really beneficial. If you can at all possible, I would go to one of the ALS certified centers, okay, a speech and swallowing center, because I got the first 7 years at UCSF. I live in California, okay, and then the doctor who did it there moved away to New York City. If you are in the New York City area or the East Coast area, okay, and you're interested in pursuing Botox in the throat, the physician you want to see is Dr. Mark Corey, Courey. He's specialist. He's the one who moved from UCSF. Okay, when I went from UCSF, I went to Stanford next. Stanford's kind of like a second tier. Okay, so it's not like the ALS certified center. It's like an ALS certified clinic. Okay, let me backtrack. Even at UCSF, okay, when I was going there, okay, and I asked Dr. Corey one time how many patients. He only had like 7 or 8 PLS patients who were getting Botox injections. when I went to Stanford, so I'm also going to their speech and swallowing center, the doctor, okay, I'm the first PLS patient he's ever seen. Okay, but he injects BOTOX regularly for dysphonia, for people who have spastic vocal cords. Okay, his technique for dysphonia did not work for me, so I had to kind of teach him where to inject. So that's how come I'm saying if you go to an ALS certified center, if you could travel to one of those, at least in the beginning to get started, I think you might do better if you had someone who actually injects for PLS, but that's just been my experience. And so, yeah, mine has always been under Medicare, and other than going over 600 units, that's when we ran into problems with the approval. And it's intensely beneficial. So that has been my experience. So thank you.
Thank you so much, Diane. I very much appreciate your sharing that with us this afternoon. I know you're going through a lot, and just listening to you, my heart goes out to what you're dealing with. So thank you for sharing that. I would really love for you to email to us the name of the doctors that you referenced, that you are having a good experience with. We would like to include them on our list of physicians, so that when folks, are calling us, asking us, who do we need to send them to in each of our states, we at least have those particular ones on our list. So if you don't mind, I would really appreciate that. We've got a number of emails that you can reach out to. So the one that you received this invitation, that will be fine. Or
how about if I just put the two names in the chat and you figure out what to do with them?
Oh, yes, absolutely. Fantastic. Thank you so much. I'd like to take a moment and go over here to the chat, because we have Diane Hayes on our chat saying that she has ALS and can't talk and has a baclofen pump and getting BOTOX injections in her thighs and think not helping now, supposed to help me spread my legs when I'm using the bathroom. So is there anything else that you want to add to that, Diane, if you can? Or you just wanted me to acknowledge that I see that? Is that right? Can you hear me, Diane?
I think
Okay.
Diane said she can't talk, so
Yes.
Norma, I'm not sure how to do the hand raising thing, so I apologize for just interrupting. I don't see a hand raise at the bottom of my screen.
It's in your reactions. Go down and look at the reactions at the very bottom. But you're the speaker, Kevin, so I'm not going to interrupt you. So please go ahead. If you've got comments, you are a presenter, and I would like for you to address anything that you feel that you can jump in and address. And then everybody else is kind of waiting in the wings. I see you, Libby. I see you, Jackie. I will get you guys in just a moment. So go ahead, Kevin.
So to Diane, and I noticed there were some other comments about BOTOX not working as effectively. First to Diane, there's been one study on HSP specifically on the hip AD adductors, the adductor muscles, which it sounds like you're trying to get to be less spastic, so to allow you to open your legs. And that study produced pretty good results for HSP. However, you can develop a tolerance. What your body does is it develops neutralizing antibodies for BOTOX in some people, not everybody, but it does happen. So that results in needing to increase the dose, or you can, that's one of the reasons that people may switch from type A to type B, or from one, there are several types of type A that are slightly different variations and chemically, and they may switch to one of those. So I would discuss that with your doctor. And the same is true for anybody that was receiving benefit but has started to experience a diminished effect in that. And one of the nice things about the reversal of Botox after 3 to 4 months, if you're not sure if it's helping, talk to your doctor, let it go, and see how you feel after 4 or 5 months. If you don't notice any difference between 1 month post Botox and 5 months post Botox, then either it's not working for you and something needs to be adjusted, or perhaps it's just not going to be the right tool for your particular type of spasticity, because this is very patient specific.
Okay, with that, let me go back over and jump on with Jackie. You got a comment or a question, Jackie? You're next in line. Mike, I see you, so hang in the wings after Libby. Unmute Jack, there you go.
I had to, yeah, forgot about that part. A lot of people get Botox once, they say, oh, it didn't work for me. And I think they don't understand that you need to mess with the dosage, you need to mess with where they inject it, you need to mess with the type of Botox. You're in charge, you have to do. I can't see Botox just not working for somebody, because it just, I just think people give up too easy and say, oh, that didn't work. Well, it takes a long time to find the sweet spot. And I found a doctor that uses an EMG guided needle, and that worked a lot better for me. The first time I had it, I kept falling over backwards. This is when I could walk. And you know, it just works better. First time she stuck the nail in, she goes, oh, it's so tight there. And I said, I know, that's why I'm here. So, and then the other thing I wanted to talk about was I get bladder Botox. And that sounds scary to people, but it makes you pretty much normal. And then in that, they also have to, the first time I had it, it lasted 9 months. Then it went down to 6 months, and now it's 3 months. And I could use it every 2 months, but you can't do that with the insurance. But they also, you can.
I thought you wanted to listen.
You
Go ahead. Someone.
it makes a difference where they inject it. You know, there's in your bladder, there's a bunch of nerves up on top. And if they inject in that area, and you don't feel it at all, they fill your bladder full of Novocaine. It sounds horrible, but it's really not that bad. It's worth it to me for being normal for 3 months. But, and that's trial and error too. They've got to figure out where to inject it and how much. So everybody should, I think, give it a try.
And as we're hearing, you know, you're going to have to advocate for yourself, and you're going to have to research what works for you. Thank you so much, Jackie.
A lot of people say, well, the doctor said, well, the doctor's not the one that could feel this. And, you know, I hear that all the time about all different things. You're in charge of your own health. So
that's exactly right.
How many
Thank
units?
you, Jackie. Go ahead, Libby. You're now online. Yeah,
Okay, hi guys. So I was asking about the Botox for your urinary tract, you know, because I peed way too much. So would that help with that? I know
Yes.
Jackie said it would.
It does, but some people have to self-cath. Did I mute myself? Okay, some people have self-cath, but I had to do that anyway before because bladder issues scare me. I've had 2 people die in my family from HSP with bladder issues. So you got to empty that bladder because it's like a pond growing algae in it. You know, you're growing bacteria in there if you don't empty it out. So So I was cathing already. So if you don't mind cathing, not everybody has to, but you
Yeah.
know, you might to empty it out.
Well, what type of doctor do you go to? A urologist?
Urologist, yes,
Yeah.
urologist.
So you would
But
have,
it not every urologist does it. So you really have to make some phone calls and find one.
but it would help with the,
Yeah, it
the-
helps with urgency.
yeah, urgency. Okay.
Yeah,
Okay.
makes your life so much better.
Yeah, because I'm already taking pill Vesicare. But then that has side effects as you get constipated. So I mean, you're like, okay, you're one thing for another thing. So
Yeah. Yeah.
yeah, right. So thank you guys.
Thank you, Libby, for bringing that up. We greatly appreciate it, and it is obviously a problem for a lot of people. So thank you. Thank you, Jackie,
Nora.
for jumping on and talking. Next, we've got Mike. Mike, can you hear us? You can unmute.
Hello, can you hear me?
Yes, Mike, go ahead, please.
Oh, hi, this is Mike Lorem. I'm an HSP person. And my concern, my thought right now is that I have an intrathecal baclofen pump and I just started BOTOX. Is that too much? Where I'm hurting myself, giving myself too many drugs?
Kevin, would you like to address that?
Sure. I don't think you'd be getting the Botox if your neurologist didn't feel comfortable with it.
To be an EMT person.
The Botox is very safe in general. And since it does reverse, it's something I think you need to, what I do anyway, is I write questions down, and either my wife, if she goes with me, or I take questions and make sure we get answers before we leave the doctor's office. And you may want to take those with you and have a more in-depth talk with your neurologist about the implications of both. I don't think they are a problem together from what I have read, but as Norma very appropriately pointed out, we're not medical practitioners, and that's something you should ask your doctor. But the mechanism of action is different, and the only thing I can think of is they both can potentially cause muscle weakness. So if you're getting Botox and your muscles are too weak, then that may be a synergistic effect with the intrathecal baclofen. But again, this is all discussions you really need to have with your neurologist. And I'll go back to something Diane mentioned earlier about going to a doctor that is at an ALS clinic. You don't need to have ALS to find out who these clinic directors are. Most of them have neuromuscular practices other than ALS, where they also see patients with HSP. You can go on the ALS Association website and search by state for clinics, and you may not be able to be in a formal certified clinic with HSP, but you can certainly contact that physician and ask if they deal with people with HSP. The reason Diane said that, I believe, and I would agree with her, is that they have extensive experience with every one of these type of therapies and their interactions, as opposed to a neurologist that doesn't specialize in progressive neuromuscular disease.
Yeah, I'd like to add to that. At both UCSF and Stanford, the injection areas, I don't get my leg injections at either of those, but the leg and that area is separate. So they're dealing with, PLS, HSP, cerebral palsy. And if you want to kind of get reference values for muscles to inject, the cerebral palsy literature actually parallels quite well with the PLS for the muscles to inject and quantities. If you're having some issues with the quantity, and anyway,
that is very good information, Diane. Thank you so much for sharing that. Mike, did you have anything else that you would want to follow up with in that regard?
No, not really. I've just experienced greater weakness now that I've just had one dose of Botox, and it seems like I'm experiencing greater weakness now. And I'm wondering if that's hurting me more than helping. And I guess I'm confused a little bit on what the best move is for me. And I'm right, and you're right. I'm going to go straight to the doctor and ask them. I'm going to tell them, hey, I have extra weakness. What's up with that? And is getting both of these a mistake?
And Mike, again, as several people have mentioned, part of making Botox successful for you is it takes some fine tuning. And as I mentioned, this is where the art of medicine meets science. And there is a lot of information. I've read the entire physician handbook from the manufacturer of Botox for how to inject each muscle. Even given that, there's some art to it, but I don't think you're hurting yourself unless the weakness is causing falls or other problems. But it's logical that two different treatment modalities that both balance reduce spasticity with muscle weakness together are going to make you weaker than you would with either one. Whether you continue the Botox or your doctor adjusts the dosage, locations, that's going to be up to a discussion with you and him. I hope that helps a little bit to clarify.
Okay.
Or do you have more questions?
No, I think I'm okay. I'm going to go to the doctor before my next Botox injection and clarify the weakness and ask him what his thoughts are and if I should stop the Botox. So I'm in good shape. I've kind of know what I need to do next. Thank you.
You kind of got to bring it back around, right? You got to figure out what's really best for you. So thank you, Mike, for bringing that out. And thank you all so very much for being a part of our Botox talk today. And I've still got several people in the wings. I got Kim and Sue and Jackie. But I also want to point out to you guys that over in the chat box, for those of you that have your computer on and you can actually see it, there's a whole world of discussions going on over on the side, right? So I'm hoping that you guys are picking up on some of that, and I will be glad to read, some of this as we get a little chance to discuss some of these other things. So please take a look over there. But I also want to point out to you that over on the very bottom of the chat box, you'll see the word to, like I'm sending it to everyone, or you're sending it to individual people. There's a little picture of a smiley face, a little picture of like a piece of paper, but a smiley face, and then like three little dots. And we all know now that behind the three little dots is like a whole nother menu, right? So if you click on those three little dots, you'll see a thing that says save chat, right? So go over there and click those three little dots so that you can save this chat that's going on, and it will be saved on your own computer. That way you guys can go back and look at some of this information that's happening in the chat box, because there's a world of things going on over there. But again, I want to remind you too that all of this information is being recorded, and we will have that available on our YouTube channel. Please save yourself the time and effort of sending me an email and asking, when is it going to be on? So we will get it on, I promise you, as soon as that tape comes through and we're able to get that in a process and then get that edited so that you will be able to understand what's being said on the YouTube channel. So we are getting that on as quickly as possible. So let me go back over now and ask Kim if she's got questions, and anybody else that's got a comment or something that you want to say. Remember, look at the reaction button at the bottom, scroll your computer cursor over that bottom black line. You'll see reactions. Click on reactions. You'll see raise hand. When you get finished, please lower your hand as well. Okay, go ahead, Kim.
Jackie, well, she's muted.
That's
I was
okay.
gonna
Go
ask,
ahead.
Jackie, how many units do you get in your bladder?
I get, let me look because they change it. I always keep track of it. So because I give them at 2 different places. So you can only get a certain amount. But I think it's interesting. Somebody said, Diane said 600. I think I am told I can only get 400. So I'm sure that was very interesting to me. I'm going to ask my
And
doctor.
then Jackie, you had already asked a question too of Diane. Why did you say not to get them BOTOX shots in different places on the same day? So I don't know if Diane saw that, but Diane, you not want to address that over?
Yeah, because I did that.
The reason being is, like, when you have 2 of the same procedures, like if you get 2 MRIs on the same day, then they only pay the second one half price. Okay. And so I don't know. I just have had so many, the 600 units from BOTOX, it bills out at about $4,000. And then the ones in the throat, by the time they add the facilities fees, the BOTOX is like $7, but by the time they jack everything up, it's about another $1,500. And so I just, I haven't run into the problem, but on the rare occasion, because they just both happen to inject on Thursdays, I just make sure I don't want to, just to avoid problems. So I think it's more for me, just precautionary. Okay. I haven't had the experience, but I've had enough troubles with Medicare that I don't want to invite problems.
Okay, I didn't know if you meant it was some health reason or, it's just insurance.
Well, the other thing is, I could muscle.
Go ahead, Diane.
20 injections, and so it's kind of tiring on the legs. Okay, and so I got, sorry,
Kim,
2 other.
Did you have a follow-up, Kim?
Yeah, I was just going to ask also, does anybody take lorazepam for spasticity? Because I take lorazepam 1 milligram twice a day. Does anybody else take lorazepam? It's a controlled substance also. Nobody?
Okay, so why don't you type that over in the chat, Kim? And then that way some other folks might want to jump on in that regard. And then we'll go ahead and take a question from Sue or a comment. Sue, are you hanging out here with us?
Yeah, I'm here. Thank you for taking my question. I have HSP, a lot of muscle spasm in my back and my butt, and get BOTOX for it. It's very helpful, but my doctor does it either just by knowing where the muscles are or by palpation. You've talked about EMGs being helpful. Can you speak more to that, about why EMG might be used?
And tell you that it really depends on the doctor and the muscle groups. My doctor does not use it. He does not need to. He watches me walk and then has me stand and engage the muscles, and doing it by palpation is a perfectly acceptable way. It may not be a given physician's preference. They may prefer to use EMG or stem or ultrasound. It also depends on where it's being done. And just real quick on the multiple injections, I get multiple injections in both heads of my gastrocs, and also in my hamstring. And
Hear me.
that all basically gets billed out as one procedure, and they show the total units of Botox drawn up, and then whatever units are wasted when they do the billing.
Thank you.
Thank you, Sue. I appreciate that. Jackie, you got another question and comment?
Oh, I just want to say, somebody asked about the EMG and asked why they do it. And the reason why they do it is just because you can see on the screen, it's kind of, it looks like it's like a little chart, and it gets real spastic. You can see where the muscles real tight. So it just helps them be more specific about where exactly to do it. But not all doctors do it. I've had doctors that do it just by palpation. It's just whatever the doctor does.
Thank you, Jackie. I appreciate that. I'd like to point out over in the chat that Ryan says that he's 40. He's finally figured out that he has HSP a few months ago. So he has been, so I've been self-treating based on symptoms, which, you know, that's kind of what we do, right? I found that marijuana, which I use about 2 hours before bed each night, keeps my bladder functioning as close to normal as possible. It makes my legs more rigid right after using it, but the benefits in terms of my bladder last for the full next day. So, you know, there's some advice going on over there. So, Ann, you're up. So if you'd like to go ahead and ask a question, lower your hand and we'll be ready to hear from you.
Can you hear me?
Yes, ma'am. Go ahead, please.
I have a real simple question, and that is, what is your YouTube channel?
Oh, I'm so glad you asked. Thank you so much. And of course, if you go and just Google Spastic Paraplegia Foundation, it should lead you directly to us. But you can also go to our website, scroll to the very bottom of the website, and you see all those social media icons. And one of them looks like, you know, the YouTube channel. So if you'll click on that, it'll take you right to our page. And what we've been doing is every one of our videos, every one of our webinars, all of our SPFTalks, you know, all of these things are all found on that YouTube channel. We've even gone back to some of the old conferences and we put all of the doctors' presentations on. And then also, as a reminder, once we have this year's annual conference, which you guys know is going to be in July in Nashville, Tennessee, it's not too late to get in on the second early bird registration, then we will also put those presentations on. What we have got, I think, is kind of as a treat, because it's really more like what we're talking about now. Dr. Fink, Dr. John Fink, he has provided to us a young lady named Chelsea Burton, who is going to be speaking. She works for the Physical Medicine and Rehabilitation Spinal Cord Injury Team at Michigan Medicine, and her medical practice focuses on the treatment of spasticity, including the managing the program's large intrathecal baclofen pump program. And she also works with training other students and residents in spasticity management. So I am really excited to be able to hear from her at the conference. And again, her presentation will be on our YouTube channel once all the videographers have had a chance to take a look at that and get that worked out for us. So in the chat box is the YouTube channel link, so you guys can jump over there and grab that. Remember, save chat over in the box, and that gives you a chance to see that. Anything else, Ann, that you would like to add?
Nope, that's all for now, I think.
Hey, thank you so much for being on this afternoon. Kim, did you have something else that you would like to say? Oh, you're on mute.
I was just reading the chats as they were coming down. Yeah, thank you.
Okay, because your hand's raised, so I just didn't know. I'll lower your hand.
Sorry, let me take it down. Okay.
That's okay. So anybody else have anything else that they would like to add or say or bring out this afternoon? There's a whole bunch of you online with us today, and I really so much appreciate you. I think you guys are finding some benefit and some value in some of the talks that we've been able to have. I'm hoping that is the case, and it seems like it is, since we've got, you know, like 100 and almost 130 people registered with us today. So is there anyone else that has any other comments that they would like to make? I'd like to keep these to about an hour. We've already exceeded that a little bit. I'd like for you to, you know, please make sure that you check out the chat and let me know if there's anything else that is of interest to you. We, again, are going to be having a talk in June about the annual conference. And then in July, we haven't yet set the schedule for the rest of these. But you guys may remember last month we had a conversation. Thank you, Ann, for the clap. That's very much appreciated. We had Brittany Casaba on talking about life hacks, and that really, really went over so well. Of course, you can find the video on the YouTube channel, but we're going to be coming back and talking with her again and bringing that back out. But it seems like there was a lot of conversation here, Kevin, that maybe we need to maybe think about maybe in the fall having another chance to talk about BOTOX again and maybe hear some more conversation about it, maybe a follow-up. So, you know, we're going to be looking at those things and considering those things. Now I've got Ann ready to ask another question, I guess, Ann, and then Deb's in the background. So hold on. Go ahead, Ann.
Yeah, regarding how do you find providers who will do BOTOX in the abdomen or in the bladder? I have a great doctor here who would do it in different areas of my legs, which we haven't tried yet, but he was not comfortable doing it in the abdomen or bladder. What method do you all use to find a specialist who would do that in your area? I live in northern Indiana. I could perhaps go to Chicago or up to Ann Arbor. But do you have any other tips? And has anybody ever had BOTOX in the muscles of the abdomen, the rectus abdominis and the transverse abdominis, those kind of things? Has anybody had those? So that's kind of two questions there.
I did not find anything on that in my research for what that's worth. And again, my only suggestion would be find a neurologist that specializes in neuromuscular diseases. And again, one way to do that is to look at the doctors that run the ALS clinics and get a hold of their practices. If they don't do that directly, they would probably be able to refer you to somebody who could. That's the only thing I could think of to help you find somebody. But there's a big difference between a neurologist who is more of a generalist or somebody that, say, specializes in certain types of neurology, as opposed to somebody who focuses on progressive neuromuscular and degenerative diseases. That's going to be who you need to find, in my opinion.
And over in the chat, we've got Susan that has mentioned that bladder injections are usually done by the urologist. Women feel like they are going to go to a gynecologist internal in the actual bladder. So this, you know, this I think is very good information for all of us to understand and to find, who do we talk to? Who do we reach out to? And, you know, we have got a list of doctors, physicians on our website. And, maybe what we need to do is try to add a little bit more information about what these doctors may be familiar with, and maybe add more to those. So as you guys are seeing that you have got this network of physicians and doctors that you are very comfortable with, and you like what advice they're giving you, the information that you're providing, it's not that we're going to put your name by their name, because everybody has a different experience with a different doctor. But what we'd like to do, again, is to be able to say, hey, in Indiana, here are the doctors that we know that have dealt with patients familiar with HSP. So if you've got, a particular one that you guys would like to recommend, and you would like for that to be added to our list, please go and look at our list. If they're not on the list, then send us that information, and then we'll update that. And that will be very, very beneficial.
Norma,
So,
can I add one more thing?
Oh, yeah, go ahead, Kevin.
Since Ryan mentioned marijuana, my neurologist has offered that to his patients medically in Arizona. I chose not to do that, but I do use CBD, and I use a combination of CBD and CBG. But what I wanted to say, and I'll type this in the chat, is there's a company that is excellent. They do all third-party lab testing on their CBD products, and they offer a huge discount to people that have HSP, ALS, PLS, and I mean it's huge. So I buy all my products for them. They're super high quality, and it's just a really excellent company. They're called Lazarus Naturals, and I will type that in the chat box. You can go on there, and they'll have a place where you can send some evidence that you have a disease that qualifies. And then from then on, you will get a huge discount.
Okay, define what CBD is, right?
So it's cannabidiol. It's the product derived from the hemp plant that is legal in all 50 states. There are several different isomers of it, hence the CBDG, CBDN, and a lot of people feel that it has much of the medical benefit, specifically neurological, that marijuana does without the THC. And it'll come in two varieties, no THC whatsoever, and what they call full spectrum, which I believe meets the federal limitations. I want to say it's like 0.3% THC they'll allow to be sold anywhere in the US. So it's a pretty easy thing to try to see if it's helpful. Most people suggest 20 to 100 milligrams a day. Again, it's very individual, but Lazarus also has a lot of just helpful information on CBD. And if you go to your local shop that sells smoking accessories and buy CBD, there's a lot of it that has very little or poor quality non-tested CBD. It's not regulated. So it's important to find a vendor that uses a reputable third-party lab to do assays on each batch for purity and THC levels. So you're sure you're actually getting a therapeutic product. Did that
Very
answer
good.
your
Thank you.
question, Norma?
Yes, it did, because it's over here in the chat. So that's very good. Anne, do you have anything else that you would like to add? I see your hand is raised. I'm not sure if you just haven't moved
No,
yet.
I'm sorry. I need to mute myself again. This is all so good, though. I'm so thankful for this.
I'm so glad to hear that. Thank you so much. Thank you so much. Okay, you guys, we have gone over by 17 minutes. Oh, Kim, did you have another question?
After you save the chat, where do you find it after you save it?
Well, what you do is, if you will click on that, then when you click on save the chat, immediately it will say chat saved, and it says show the folder. Okay, so if you click on show the folder, then it will pop up and show you, mine's in my documents file. That's where I kind of have it going after, we save it. So, but mostly it's on your PC in your documents file. But again, if you will see, after you click on those three little dots, save chat, then it says real quickly, show in folder. So click on that show in folder. But let me tell you guys, what we will do, because of all the great information that is on here, you will have, again, the YouTube channel that will be up. But let me tell you what to do first. Go to the website, because, we really want to see all of those clicks on the website. That lets our board of directors know that we're actually making progress in reaching out to you guys. So we like to look at those Google statistics and analytics and all those numbers. So we really dissect all that stuff. So we really want to make sure that we're drilling down and bringing you guys great information. And that's how we can do that. But go find on our website the thing that's called SPFTalks, okay? That's where you always need to go to where you can find the next meeting that we're going to have, where you might find the list of the next meetings that are coming up, and most importantly, the links to the videos. And we will also provide there a chat list of conversations, not also necessarily the quick little things, the thanks, the da-da-da-da-da. And we probably won't even share your name. We will just have what the conversation was that might be beneficial in the information. So we will edit all of that stuff off so it's not giving out your personal names. And we will then have information on the website under SPF Talks. There's a little hourglass or the magnifying glass that lets you search. Just type in there the search. And Ryan, I see you over there hanging out, so give me just a second. But we will have that information on there so that you guys can find the chat information. And then we will schedule another time where we may get back together, Kevin, don't you think? And we can maybe do a follow-up BOTOX conversation. Seems like everybody's pretty excited about having this information. So, Ryan, why don't you go ahead if you've got comments? Okay, great.
I'm sorry, Norma. I'm in if you think it would be useful.
Second here.
Okay.
Yeah, on my computer, when I hit save chat, it doesn't give me any place to put it. So
what it does is it automatically saves it to your computer. So you don't really put it anywhere. It saves it to where it automatically has been assigned to send it.
How do I find that on my computer?
Well, again, go back to the three dots, and before you hit save chat, be ready to see right above who can see your message. Do you see that? You go to the very bottom of the chat. Okay, do you see it says to and everyone, and then the next line up says who can see your message recording on? Okay, right above that, be ready, and you will see it say chat saved check mark, and then beside that in blue it says show in folder.
Gotcha. Thank you.
Yeah, so click on that, then it'll take it over and show you where you've actually saved it on your computer, almost like an automatic thing. So, what I want to do with these SPF Talks, and I see you, Diane, hanging out there, so just a second. What we really want to do with these SPF Talks is to be able to, number one, understand our technology. and you got a lot of nerds, right, Ryan and Jaco and Hank and all you wonderful folks that, know all about this technology. But there's some of us that don't really know about the technology, and we're just trying to kind of stomp along and figure out how to make it work for us in our homes. And sometimes, the internet blows up, and sometimes the power goes off, and you just have to kind of laugh. And that's what it really comes down to, is just try to go, okay, what do I do now? So that's why we've got all of us on here to learn and to teach. Those that teach, the rest of us are ready to learn. And what we need to do is to be in a position where we can, when we have a doctor that comes on, or we have someone that's in the professional medical field, that comes on and they spend their time talking with us, we want to make sure that you guys are so comfortable with the technology that you can be available to see these doctors and they can see you. You might not be able to travel to the University of Michigan or the University of Chicago or, wherever else, Brazil or Japan. You might not be able to travel, but I can get those doctors on this video with you. And, not that we're talking about telemedicine, right? Because we're not going to take their revenue away from them, but I want them to be able to see that we've got 130 people on here and we can't all talk at the same time. So us teaching you how to interact on this technology platform gives us the ability to maybe have that doctor on and that doctor be able to look at you and talk to you, and you not even have to pay a copay, right? Wouldn't we all like to have that moment? I would. And that's why I want to help you guys. If you've got problems learning how to use your computer technology, please come on and talk to us about it. And if there's, a moment you want to ask a question about something, go ahead. Let's make sure that your technology works. And that way, whenever we have a doctor on, after the conference, I'm going to have some lined up for us. Then we're going to be able to talk and visit. So, Ann, did you have anything else that you wanted to say? I see your hand still hanging there.
Nope, I'm all done. Thank you.
Okay, so if you see up there, let me just kind of tell you guys this too. So you see where it says mute and ask to unmute. If you scroll across the blue lines, if you see those three little red dots, blue, it's a blue square with white dots. That's what mine looks like. I can lower your hand, but you may be able to go up there and lower your hand yourself. So please do that. And then that way I won't have to come back and ask you. But Diane, please go ahead. You're up. You got a comment, question?
I do have a couple comments. One is, in my experience, I have found that I used to go to a therapeutic pool that was 96 degrees, okay, that the hot water will metabolize the Botox out of my legs. And so I couldn't do that, and I couldn't do a hot tub either. So especially as people are approaching summer, just if you do enter into that kind of a situation, you'll find that your Botox is less effective. It very likely is because the hot water metabolized it out. So that's one thing I found in my experience. The other thing is there's a very rare side effect that I actually have with the Botox. Okay, so if you find like your first experience with Botox, instead of helping you to get better, your muscles actually get much worse. Okay, don't give up on it and do it a second time, because for me, the first time the Botox goes into a muscle, instead of relaxing it, it actually seizes it up. Okay, and then when you do it keep it up at every 14th week, 14 or 13, 14 weeks, there's still a therapeutic amount of Botox that's left in the muscle that'll keep it relaxed. And so then when you add the next dose, you can keep going. But it is possible to actually get worse with your first injection of Botox. It's very rare. When the pandemic came, I get 8 muscles, and there was a delay, and so it was 5 months versus 3. Too much had come out of the legs, and 3 of the muscles went the wrong direction, and it was horrible until it wore out. And then once I got the next injections after that, I was back on track. So just be aware that it is possible for things to go haywire. Don't give up on it. That's my last comment. And I don't know how to get rid of the hand, but I'll do my best.
Hey, I don't want to hear that. I don't want to hear that that's your last comment, Diane. This is just, you're going to move on, right? We're going to come back and comment later and on another day. Not your last, just the next one.
Can I ask something?
Hey, I'll lower your hand.
Can I ask something about the hot water?
Yes.
What if you take a hot bath every? What if you take a hot bath every night? Will it take that Botox away also?
You know, I don't know. I used to go to this pool, okay, and I would be in it for like an hour at a time doing exercises. Okay, for the gentleman who got too weak between the Botox and the pump. Okay, so the one time when you know the first injection went in, and it was like, okay, this is a really horrible experience. Basically, I sat in the 104-degree hot tub for about 4 days in a row, and I was massaging it, and I took like frozen bottles of water, or ice, and kept adding water so I could stay in the hot tub for about an hour, and I was able to get the Botox out in about 4 days. Okay, so I could walk normally. So I definitely know that the hot temperature helps to facilitate it. And then when I was on schedule and I was going to the pool, it's like, okay, my Botox benefit is just going away. So I gave up the pool. So I don't know about baths, but I would think it's on the same order. I don't know how hot a hot bathtub is. Like I said, the pool was 94 degrees and the hot tub was 104. And that was just my experience.
That is very good information, Diane. That is very good information. Thank you. Thank you so much. Okay, guys, we're going to go ahead and shut this down now. We're actually 30 minutes over, and I hate to shut it down. I really do. But we've got to go ahead and close it out this afternoon, and we're going to get back with Kevin another day, Kevin, and we're going to be jump-starting another Botox number 2. So you guys be ready on the lookout for that. And then also remember, go to the website, look at the SPF. I'm just going to talk for a couple of more seconds and give everyone a chance to put in your last comments on the chat and give everyone a chance to save that chat. Aren't you glad I told you about that? Isn't that wonderful? Just little tidbits, stuff like that, right? So Ryan, Jacob, you guys got some ideas on things like this, let me know. And we will be glad to share those things and help all of us be on the same page. You know, we don't want to hold any information. We want to give it all out. We want to tell you everything about the things that we know. We want you guys to know that we've got a hot wing challenge going on. So please jump over there and look at that. Watch that video of Greg, because it is really hilarious, him eating a hot wing because he hates hot stuff. So you got to go see that. And then also, you know, June, we're going to be talking about the annual conference. Don't forget, you still have time before May 31st. If anybody is interested in wanting to register for the conference in Nashville, that's going to be held in July. And then also we got Awareness Week that will happen in August. So we got a lot of things going on. Please share, share, share. And if there's anything else that we can do for you guys, then don't hesitate to give us a call, send out an email, wave a white flag, let us know that you need some advice or help. We may not know all the answers, but we've got a great network that we are growing, and it is you. And it is you that we very much appreciate. So make sure that you continue to look at the information that we have on the website, and then we'll call it a day.
Can I ask one more?
Okay.
Where is that hot wing information?
It's on the website. Go
it
look
is.
at the event category. Everything's on the website. Just type in up there with the magnifying glasses, which is the search bar. Type in there hot wing challenge. Okay.
Okay.
And then it will lead you and show you some of the videos that we've got that's happened. And I think there's already like 6, maybe 5, 6, 7 people that have already created their own platform. You will go onto our platform and create your own fundraiser, which really kind of becomes your own website page. And that lets you then send it to your family and friends, and then they can donate to your platform, to your fundraiser. So take videos of you guys eating the hot wings, get together on Memorial Day weekend, right? That's the kickoff. We actually have it on there so that we can go ahead and, let you know about it. Hank has already put over in the chat box the upcoming Hot Wing Challenge. So you guys click on that, and I'm gonna shut it down at this point. And if you guys have got any questions, then feel free to email us. You've got all of our email addresses and contact information. And Kevin, thank you so much. Thank you so much for taking time today and spending time. And I'm going to give you the last word, Kevin.
Well, thank you. And I really appreciate everybody who had comments and contributed. I've certainly learned a lot, and great talk. So thanks to everybody.
All right. You guys take care. Be safe. And we'll see you in June. Okay?
Thank you.
Thank you all.
Bye.
Bye-bye.
Bye.
Bye-bye. Thank y'all. Thank you all very much.